All right, so my guy at the top, Professor Muhammad Ali Pate, CON, Coordinating Minister of Health and Social Welfare. Sir, I don't know if you have seen this very disturbing and triggering news that the FCT doctors are going on an indefinite strike. It is a very, very big problem. I am even restless. As I see the news, I get restless. Let me give you an instance. That if they rush somebody go hospital, maybe a pregnant woman, they rush her go hospital, then the country says she get complication, and then they need to do a surgery. Doctor no dey. Do you know how crazy that is? Doctor no dey. Maybe pikin swallow something, he hook for small pikin throat, pikin of 2 years, you know how children they play. You rush the pikin go hospital, doctor no dey. There's some problem where person will get emergency, accident, emergency. Doctor no dey. Do you know how crazy this is? In the whole city, doctor no dey, they don't go strike. Indefinite strike, meaning say they don't know when they will come back. Do you understand? Sir, please, I'm calling your attention to this because me self, I'm scared. And right now, me self, no feel well. Imagine going to the hospital, they can't go see one thing on my body, they want to operate me. Doctor no dey. Do you understand? I know you might not relate. Because if they decide to, maybe if we do investigation deep now, we decide to check your medical record, you know they even treat yourself for Nigeria. I will not be surprised because even our president know they treat himself for Nigeria. Our last president, Buhari, now for hospital, for abroad, now buy. So if you self know they treat yourself for Nigeria, I will understand. But me, I can relate. Do you understand? I can relate because I'm a ghetto boy. I'm a street boy. I know what the street people are going through. Do you understand? And me, I relate to their problem because I see. No, every time, oh, very dark man, we need this. So me, I know. I beg, sir, please, you have to do something about it. Please. I know most of you, the elites, you don't treat yourself in Nigeria, or you go to the private hospitals. But I beg, the small hole they manage, we need to manage it well. Please, this is a very big problem. Please, sir. I don't know. We are giving you like 3 days to please. I'm not giving you ultimatum, but I beg, in like 3 days time, please look at this matter. We don't want a reason why we know your office. We don't want any reason why we have to come to your office. Right? With all the doctors, we have to pull up in your office. Come stay there, may you remember. I don't know what the problem is. Other countries, they treat doctors like gold. That's why a lot of doctors, they come up from here because I know they respect doctors enough. That's why they run away. Person go study medicine here, they run. It's not studying to actually work in Nigeria for the benefit of Nigerians. They are working to go abroad and go and have a better life. Because this place, don't value doctors and nurses. And you know why? Because the politicians don't use our public hospitals. There are people that are supposed to be earning high in this country. See, doctor, nurse, police, teachers, but all these people now steadily they hold their money. Police go finish service, you go dey cry for pension and gratuity. They don't chop your money. All in work, nothing to show for them. Doctor go dey cry say they hold their money. Doctors for public hospital for crying out loud. People where they save lives. Teachers go dey complain. No respect for these 4 professions, and it's sad. It's sad. I don't believe people should leave Nigeria, but the way things they go on these days, let's say, man, if you got opportunity to go, you will go. Because there's no respect for these professions, and it's sad. Indefinite strike, meaning say they don't know when they'll come back, like they are gone. And you will not blame them. When I see the news, I panic. I'm like, these people don't get conscience, even at that. But they also need money to run their family. Person and doctor know me say if your own person sick, they'll treat them free. You go pay. Because the syringe, they buy them. So if you go National Hospital now, no level, no doctor. If you go MC now, FMC for Abuja, no doctor. Professor, please, sir, with all due respect, I don't want reason why will make you be the first minister for health, I mean of health, where they will protest against. Do you understand? But this one is scary. If it was another thing, we will say, okay, doctors know the hospital. You know the kind of problem that is. Doctors know the hospital. Like, sit down now, close your brain. Maybe close your eye, maybe imagine them. Doctors are not in the hospital. But again, like I said, I will not fault you. Because the people at the top have already taught you people. The pawns, they've taught you how to do it. President, they go abroad, go they treat himself. Vice President, the same thing. Everybody, the same thing. House of Rep members, abroad. Mentality of slaves. Big mentality of slaves. Because make it make sense. Every time, oh, we want to go for vacation and check up, our politicians. But those people never ever come to Nigeria to come and do vacation and check up. See? President, they travel. None of them don't travel come. It's a shame and a disgrace. They see where Buhari, a former president, by. It's a shame. It's a slap to the whole Nigeria. That Buhari himself, that was the president, did not believe his country enough to treat himself here. See people the same thing. Any sport in France. No hope for the country. We did not laugh. But it's not cruise. I beg. Sir, with all due respect, sir. With all due respect, sir. Professor Muhammad Ali Pate, with all due respect, sir. It would be nice if you look into this in 3 days. It would be really nice to help all of us. I'm speaking on behalf of the people on the streets. Please, thank you very much. But if you decide to play, you gotta learn, and you will actually learn the hard way. Don't play.